Thank you so much, everyone, and thank you for staying to the end of this session. My name is Hanna Knudsen. I'm on the faculty at the University of Kentucky, and it's my pleasure to share with you our efforts around scaling up naloxone distribution in Kentucky. I do want to make acknowledgments first to our research participants, which included people who inject drugs, people who use drugs, as well as concerned community members, and we do have one conflict of interest that's noted here on this slide. And this work was part of the Healing Communities study at the Kentucky site, and so we were supported by the U.S. National Institutes of Health and the Substance Abuse and Mental Health Services Administration. So in terms of background, I don't need to convince you that the U.S. has had a longstanding opioid epidemic, but many of our very few communities have been successful in sufficiently scaling up overdose education and naloxone distribution. And so we think it's important to be able to identify the types of agencies that can reach people most at risk and sort of broaden the impact of OEND. So in this particular analysis, we examined associations between types of agencies distributing naloxone and two dependent variables. One, recipients' personal history of experiencing an overdose, and then secondarily, a history of witnessing an overdose. And so just in terms of the Healing Communities study in Kentucky, we had a team of implementation facilitators who worked across 8 Kentucky counties and ultimately engaged 105 agencies to either adopt overdose education and naloxone distribution for the first time, or particularly in the case of syringe service programs, to expand the scale of their OEND efforts. And those partner agencies then collected anonymous data from recipients of naloxone. So I'm going to show you quickly descriptive statistics for our naloxone distribution by agency type, and then the results from multivariate models to examine differences across agency types that also adjusted for demographics and the 8 counties. That slide did not display the right way. Let me go back and see if I can get that. Okay, I'm not sure why that's not showing, but I will note that across the 18-month period, those 105 agencies distributed over 13,000 units of naloxone. And about half of those units were distributed by syringe service programs. The next most prominent agency type were medication treatment providers. They distributed about 22% of the units, and then jails distributed about 11% of the units. And the rest were kind of across social service agencies, drug courts, counseling-based agencies, healthcare agencies, and opioid overdose response efforts. In terms of our multivariate models, I'm actually going to head over to the conclusions. So when we looked at, we used medication treatment programs, those dispensing methadone or buprenorphine as the reference group, and we found that the syringe service programs, as you might imagine, recipients there were much more likely to report a personal history of overdose as well as having witnessed an overdose. And so certain kinds of settings, like syringe service programs, are critically important. I know that's not surprising to this audience. They had very large reach in terms of the number of units distributed. They also were reaching individuals with at higher risk of overdose. But what I think was important about our findings is we identified some additional settings. The social service agencies, jails, and overdose response efforts, response teams were more likely to be reaching people with a personal history of overdose or having witnessed an overdose. While those agencies distributed fewer units of naloxone on average, they were reaching fairly high-risk individuals. And so in terms of community impact, we had a lot of stories from these 105 partner agencies about lives saved. And I will note that even though the study was able to provide naloxone at no cost to our agency partners, we cared a lot about sustainment. So we connected them with the state, which could provide ongoing no-cost naloxone after the study. And I'll just last note that the QR code will take you to our implementation materials, which we've posted online as an enduring resource that are free open access. And thank you so much for your attention.